Thank you for making time to be with me. This is going to be an interesting 45 minutes or so, and I hope you find it really beneficial and insightful. Just as we're beginning, I want to remind those of you who might be watching this on the replay to remember to like the video, subscribe to my channel, and drop a comment. It helps to boost my channel on YouTube a little bit, makes these videos more visible to other people, and I really appreciate that. I would love it if you would take just a moment and find the chat box and just say hello, because I like my webinars, my mini classes to be interactive. And if I know you can find the chat box and can ask questions and make comments, then we'll have a much more useful 45 minutes together. Hi, Barb. So good to see you. And Catherine, great to see you. Hi, Corrine. Excellent. This is so good. So good to see so many of you. There's quite a few more of you here as well. So many of you joining us and saying hello. Thank you again for making the time. I would also love to know in the chat box just really quickly if you have any iridology background already. If you do, just give me iridology in the chat box so that I know how to tweak this presentation on the fly for you. I want this to be really useful. So Barb has a little bit of iridology under her. That's so good. And so does Corrine. Okay. Excellent. So a few of you do, some of you are brand new. So I'll make sure that we stay sort of basic enough, and I don't mean that to be an insult to anybody, but basic enough that this makes sense to you, but meaty enough for those who've got some background. So fantastic. Thank you for dropping those comments in the chat box. I really appreciate that. So again, I want you to feel free to drop comments and questions in the chat box. If there's time, I will answer them. If they're appropriate to where we're at, I will make sure we deal with them. And we're going to just hit the floor running here today. The first thing I want to do is drop a comment, share a comment from one of my students. She was like many of you, she already had iridology training. She said, I just wanted to say that as a new student who has worked in iridology before this, and is a certified iridologist through another teacher, I've learned more in the first 2 lessons of your dynamic iridology course than in all of my previous iridology training. I'm so glad that I decided to sign up. I know that after taking this course that I will be able to offer my clients the best and most up-to-date knowledge. That to me is just so exciting when it's only 2 lessons in as an NHCP, and she's already feeling like she's got more than she got out of all of her other certification training. So that's exciting to me. I just want to remind you that what we're talking about today is meant for your information only. It's not meant to diagnose or prescribe. You are responsible for whatever results you get from using this information. And if you are a practitioner and you're going to use this information with your clients, please know what the laws are in your jurisdiction for practicing iridology and for what you can and can't say. All right, so when we do iridology, you already know we look at the iris, so that's the colored part of the eye. We look at the sclera, that's the white part of the eye, and we look at the pupil. Each of these parts of the eyeball give us different information. There's not one of them that is standalone. When we combine all of these together, it gives us such a depth of understanding of how the body is working, how it's put together. It gives us an understanding of our client, the struggles they might be having, and it helps us understand their concerns when they've got a symptom or a problem, and we've got markings anywhere in the eyeball, and we know how to interpret these, and then we know how to combine their symptoms with what we see to ask questions to get deeper information. This is what iridology is, and this is why we actually need to be incorporating the pupil into an analysis. It just adds another layer of information that is so helpful, so critical. So the pupil does contain some valuable knowledge. Again, it's not standalone knowledge, but it is, or standalone information. It is information that helps us to layer up. It adds depth, it adds breadth. And it also, again, will help us to understand what further questions we could be asking our client to get even better information from them. Are you ready to look at some pupils? If you are, give me pupils in the chat box. So as you're giving me that, yeah, I love the lightning fingers that we've got going on here. Thank you for this. So good, so good. as we talk about pupils today, see if you know anyone who fits into any of the categories that we're talking about. The first thing we're going to talk about is meiosis. Now, this is an ophthalmological term. You will find that in modern iridology, we are more and more using correct ophthalmological terms rather than made up terms from 200 years ago, right? And this is really important because it adds understanding and credibility to what we are doing. Now, when we talk about meiosis, what we are talking about is the size of the pupil. The pupil size gives us really good information. Now, here is something that you need to really remember. Even though we are doing it this way here, you would never do it this way in a clinical setting. Let me explain what I mean. When we're taking photographs of an eye, we're using fairly bright light. And you already know, just from everyday life, that bright light constricts the pupils, right? So I cannot look at an eye photo and say, in truth, this person has meiosis. This person's pupils are miotic, right? I can't do that because I don't have a photo of their eyes without the light, right? So in truth, we only assess meiosis when we're looking at a person face to face. Does that make sense? That we cannot assess meiosis from a photograph? If that makes sense to you, give me makes sense in the comments box. All right, fantastic, fantastic. Love this. Good. Thank you for commenting. I truly appreciate it. Now, when we see meiosis, we're going to dive into any anatomy and physiology background you've got. You will remember that meiosis or a constricted pupil is often an indication that the person you are working with is currently in the parasympathetic response state. Right now, you'll remember that parasympathetic means bringing them back down to earth. They might have been in a heightened situation, the fight or flight response, but now they are back down to earth. They're calm, their heart rate is normal, their breathing is normal, their blood pressure is as normal as it's going to be, lots of things like that. And the pupil gets smaller, right? So when we see someone in real life and their pupils are small and it's not bright light, I mean, if you're outside at high noon, everyone's going to have small pupils, or they should have small pupils, right? But if you're in normal room lighting and your client has very small pupils, you know that they're probably feeling quite relaxed. They're probably very comfortable where they're at. And this is a good thing, right? Especially if it's their first appointment with you, because a lot of people are a little bit anxious or a little bit nervous on a first appointment. So we might see slightly larger pupils on a first appointment, which would be completely normal, right? When we're anxious, the pupils get a bit bigger. When we're calm, they get smaller. Now, when we see small pupils in everyday life, this again is someone who likes to be in control of their world. And as long as they've got control, they stay calm. As soon as they don't have control, they're going to lose it. So Karine is asking, do you generally do an iridology exam in a normal light room or in the dark and with a okay, no. The light you see here right now, this is my consult room, and I use normal room lighting. When I'm doing an iris exam, I actually do have handheld equipment, but I'm not assessing pupils with the handheld equipment, at least not the pupil size. I'm just assessing that as I'm sitting talking with them face to face, right? And then I might take a look with my handheld, but I'm also going to shoot photos, and I'm going to work off the photos with my client here, right? I don't like to have my people sit there with their eyes, wide open and drying out and being very uncomfortable. That's not a good thing to do. So this tells me if this was in normal room lighting and it wasn't a photo, it would tell me that this client was very calm about being here and had probably not had much excitement in her day, which is maybe a good thing. But again, it tells me that she wants to be in control of everything, that's a really important thing for her. And so I'm going to try to give her options in my session with her where she is in control. Like, I'm not going to say, you need to do this, this, and this. I'm going to say, here's some things that would be beneficial. If we were to talk about this and this, which of those things would be more likely that you'll follow through with? Which of these sounds more doable to you? right? I'm going to give her some options so that she can have some control. Here's another example of meiosis. Again, the camera lighting is going to make their pupils very small. And so we can practice assessing meiosis from a photo, but we would never actually assess meiosis from a photo. We always want to see the face right up close. Now, for those of you, do any of you have an iridology camera? Not an iriscope, but a genuine like 24 megapixel digital camera that you do iPhotos with? If you do, give me camera in the chat box. Okay, so we're not seeing that come through. So I'm not going to talk about the photographic alterations and adaptations you need to make when you're doing dark eyes then. Remember just that the small pupil says this person likes to be in control. Now I want you to think about that and think back to your anatomy and physiology and what could be some of the things you might see again if someone has small pupils. What would you expect their body responses to be? What would you expect their emotional responses to be while their pupils are small? Right? These are things that you need to be really starting to connect here, because one sign does not mean one thing. One sign impacts many things, and we need to know how to link things together. So I really want to see some comments in the chat box. If you're seeing small pupils, and it's normal room lighting, and we've already said these people are in a calm situation, what are you likely going to see as far as their immediate physiological responses? Let me know in the chat box. I've given you some clues as to what some of them are already. This is actually seeing if you're paying attention. Relax, sitting comfortably, relaxed shoulders. I like that one, Stacy. That's great. Yeah, they're sitting comfortably. They're relaxed. They're calm and relaxed. Yeah, yeah. Yeah. They're not going to be white knuckling the arms of the chair. Normal breathing. That's a really good one. They're breathing slowly. Yeah, fantastic. This is good. Excellent. They're probably not going to be sweating or perspiring, right? Because they're okay. They're safe. They're comfortable. They know that where they're at is a good place. So that's a good thing. Let's look at the flip side of this. Mydriasis. That means big pupils. Now, we can assess large pupils from a photo. Why do you think we can do that? We cannot assess small photos from a pupil, but we can assess large pupils from a photo. Why can we do that? What do you think? Any ideas? Because the light constricts, not dilates. Yes, Stacy, brilliant, perfect, absolutely perfect. If we are shining bright light in this person's eye and the pupil stays large, that bright light has constricted the pupil as far as it's going to constrict, but it didn't constrict it very far. So that's why we can assess mydriasis from a photo. Excellent. Really common for young children to have mydriasis. Why do you think that is? Why do you think young children frequently have mydriatic pupils? Any ideas here? Why do young children tend to have mydriatic pupils? Oh, Catherine, absolutely brilliant. You were so right on. Yes, because so much, and this is exactly what she said, situations are usually new to them. They're not sure what to expect. Exactly. So much of everything is new. And so they're always in that slightly alert state or that hyper alert state of, is this safe? Am I okay here? Is this where I'm supposed to be? Am I supposed to be doing this? And that can throw them into that sympathetic response. So when we see the large pupils, this is someone who is in the sympathetic response, right? And so when we see that, we know we're likely going to see faster breathing. We're going to maybe see increased blood pressure. We might see perspiration. We might see digestion slowing down. These people might have really poor digestion overall. But as these people with the large pupils become more comfortable, their pupils can come down a little bit in size. Really important, whether you're doing handheld with the handheld magnifier and flashlight, or you're doing photography, be very aware that when you've got someone who's got very large pupils, that light is very irritating. The large pupils are letting much more light in, and that is, it's uncomfortable. So don't sit there with that light, shining at them for too long, because they're not going to be happy with that. Remember too, though, that large pupils also happen when you're looking at something beautiful or at someone you love, right? You just want to drink it all in, this beautiful vista, this wonderful person. Your pupils will get larger so you can actually see more of it. So that's, and that's not, I guess that is sympathetic in a way, although you're in a calm state usually, hopefully. Okay, so, oops, that jumped two. Let's go back one. So these are slightly mydriatic, and these are actually the same person. Look at the difference in the colors between the right eye and the left eye. His right eye has so much more of the brown tones. The left eye has not so much of the brown. Same camera, same day, same exposure. We know that because we've got the exact same light artifact here. So when we see that the pupils are slightly mydriatic, we need to stop and assess, where is this person? Now, this is a young man in his mid-20s. He's had some PTSD. He's had some anxiety issues. He's had medical leaves because of abusive situations in the workplace. And so he's really had some struggles, but he's doing beautifully now. And he's really learning how to manage his thought processes and how to be in control of his body and to choose his responses consciously rather than always just reacting to things. We've really worked on nutrition with him and on nourishing his body well also. What that means is that over time, when we've got these large pupils where we know this person is always in that hyper alert state, with over time and with the right kind of nourishment and training and support, we can get this person to actually function more in the parasympathetic state and bring their body into a better balance. So, so important. All right, we've got more eyes to talk about. I'm just going to take a minute to introduce myself because some of you, I think, are new to me. And so welcome. So good to have you with us. Also really good to have people that I'm familiar with here too. So welcome to everybody. My name is Judith Cobb. I am a level 3 IPA certified iridology instructor. At this stage of development, there are only 8 level 3 instructors in the world. I was one of the first 3 to certify at that level. IPA makes us update our credentials every 2 years, and I don't have all of my badges and everything all the way back, but this shows the most recent ones. I've been a certified iridologist for a lot of years, for many decades, a certified constitutional iridologist since 1993, and I've had 8 different teachers, learned 3 different styles. I've really worked hard to keep up to date, which of course is a part of why I'm a part of IPA, because they really stress the importance of ongoing training and ongoing certification. I'm also a master herbalist and a holistic nutrition consultant. These are the professional organizations that I'm a member of. I've been in the industry for over 4 decades, and I've been teaching for most of those 4 decades. Actually, my original university degree was going to be in education, but I dropped out just before I graduated. So you get the benefits of all my training on how to teach, as well as the benefits of all of my experience and training that I've done in the holistic fields. So some more eyes, an ellipse. When we look at pupils, they are not always round. And, we often think they are. That's how we're taught to draw them in, art classes, but they're not always round. When a pupil is not round, it gives us information, valuable information. So when we have an ellipse, so we've got a pupil that is slightly oval shaped, we are going to look to see where is the axis, where is the long side of that. So the axis here is like this. So this is a client's right eye. And this is then a right ellipse, a right a superior ellipse. So that means that we've got the top part of the ellipse pointing to the client's right side. And so with this, did I do that right? I'm sorry, I just misled you. It's a left eye. Feel free to correct me on anything that you know I've said wrong. This is a left eye. Sometimes I get my rights and lefts mixed up. I'm not going to say I'm dyslexic, but sometimes I have to just, cross my arms and go, okay, what are we looking at here? So that's a left. So this is a superior left ellipse. And so what we know about ellipses is that when we have an ellipse, it increases the risk of bronchial issues. Increases the risk of bronchial issues. It's not a guarantee they're going to have them, but it increases the risk. And so when we see these, you got to know which eye you're looking at. You got to know which direction the ellipse is going. And then from there, you can go deeper to determine whether it's going to be more right lung or left lung, and so on and so forth. Now, this is the eye of a friend of mine who is in his late 60s. He is a type 2 diabetic, and he takes metformin. And he's pretty sure he's just okay the way he is. And so he let me take his eye photos, but he's not willing to do any dietary work to try to get off the metformin, to get his weight under control. He just figures if his brothers are diabetic, I think his father was a diabetic, so it must be in the family, so there's nothing he can do about it, so oh well. And that makes me very sad. But we're not going to get too much into the diabetes here because we're just looking at the ellipse here. Here's another ellipse. Again, look at this one. So this is, I did that wrong. You guys, I'm having brain farts all over the place. Oh, sorry. I hope that didn't offend anyone. The narrow side is to the right of the pupil as we're looking at it. That means that was a right eye. Man, I'm not impressing you much, am I, today, except to admit that I can make mistakes. Here we've got the narrow side to the left side of the pupil. That means this is the left eye. There you go. There's another little tip for determining whether it's a right or a left eye. And I'm sorry about that. So with this, I just do that sometimes where my brain just skips a beat, and my students are really good at catching me on it. So again, we're going to look at the ellipse. Which direction is it pointing? This one is a right superior ellipse. So we're still thinking about respiratory issues here. All right. Now, again, not everybody who's got respiratory issues is necessarily going to have the ellipse, but it will show in many people. The next thing we want to look at is flattenings. And so as we look at this, we've got the pupil looks like it's been squashed at the top and down here. We've got special maps that we use. Many of you have seen iridology maps where it's got all the body parts on it, right? We've got special charts and maps we use for flattenings, because what we're going to look at here is if we're flat here, that flattening is giving us information about this set of organs in particular. So whatever is here in the iris map, and it will likely give us information about what is across the eye or opposite as well. So the flattenings give us information about two different things. And it's really not that it tells us specifically what an issue is, but it tells us where to look for issues. Does that make sense? That some markers just tell us where to look for issues, because this gives us information about spinal subluxations that have been long-standing. And when we understand which part of the spine has been subluxed for a long time, then we understand the nerve beads that are being affected. Does that make sense? If that makes sense, give me makes sense in the comments box. Here again, this flattening is going to teach us about different subluxations. And we're going to be looking at what organs sit in this area in an iris map. And we're going to look across to see what other organs could be affected. Now, this client actually does have asthma, and these eyes suggest kidney and adrenal and bladder lung. Okay. And when you understand the chemistry of asthma, you understand that the adrenals are involved, that acid balance is involved. And so that's where the lungs are going to run into trouble. Okay. So we're always looking to connect. We see the marker. What organs is it teaching me about? How does that help me understand what's going on with my client? Here again, we have flattenings. In this case, they're all inferior. And we've got inferior medial and inferior lateral here. And this was a young lady who came to me. She had not been diagnosed by her doctor with PCOS. Every symptom she presented suggested PCOS, from menstrual cycles that were 8 weeks apart to weight gain to increased facial hair. It was all looking like PCOS. When we look at where these flattenings, they are telling us spinal subluxations that will affect pancreas, liver, and ovary. Well, if that doesn't spell PCOS, I don't know what does, right? And so this gave us information for us to begin working with her diet. Now, she was a university student at the time on a limited budget, so we had to keep the recommendations within what her budget would allow. Mostly what that meant was not eating in the school cafeteria, getting off the meal plan, and walking 2 miles to the grocery store twice a week to purchase fresh foods, proteins, and veggies that she could prepare in her own apartment, right? And she was willing to do that. So that was excellent. So that gave us, when we understood these flattenings and then understood her symptoms and then looked a bit deeper for other markings in the eyes that would corroborate the story, it made it easy for us to come up with some recommendations that she could begin implementing right away, even on a budget. So important. This is one of my clients who has been with me almost since the beginning. She was in again recently. My clients will come in for 4 or 5 appointments and then they feel great. They're disappearing for a few years. And then they come back when they start to come undone again. And so they fade in and out. And I love that they do that. It means the time that they're away, they're hopefully maintaining. But when they're coming back, they trust me enough to be able to, and we've got a good enough rapport that they want to come back and let me coach them some more. So when she was in recently, we thought about, because we were both having babies at the same time, what baby was she bringing in and what baby did I have attached to me while I was working with her? And we figured out that she's been with me for probably 42 years now. So what we see in her right eye, so that's on this side of the screen, narrow side of the iris is to the right side of the pupil. So this is a right eye. This tells us pancreas. In her left eye, this also tells us pancreas, and so does this. So when she came in, she had had a lot of trauma in the family and had had a lot of things, a lot of stress. And so she wasn't taking good care of herself. Not the care that I knew she could take. She's got good herbal training. She's got amazing nutrition training. She's got a lot of the knowledge that she needs, but she was overwhelmed and she couldn't sift through it to find what she needed. And so she came to me again, and she brought in her labs. She had elevated hemoglobin A1C, elevated triglycerides, elevated cholesterol. She's got indications in her eyes that suggest her liver is out of balance and genetically wanted to be for a long time. We've got things in here that corroborate the story of the triglycerides and cholesterol. We started working on it, and we started really simply with her because, again, she was overwhelmed. Her husband has 2 different kinds of cancer that are not fast-acting cancers, but they're sure making her life miserable. She had a grandson who had attempted suicide. She's got, her children are a little on the narcissistic side, as is her husband. And so she's carrying a lot. She's nearly 70 years old. And so we had to start simply with things that she could do. So we started with, can you get out for a 30-minute walk every day? They've got a cute little puppy. And I said, can you take your puppy for a walk for 30 minutes a day, just by yourself? She said, yeah, I could do that. And I said, okay, so can we get you making breakfast every day? Like having some protein and some veggies at breakfast. Can you do that? Yeah, and we talked about what that would look like. Yeah, she could do that. Her husband was doing a lot of the cooking. He cooks what he likes, not what's good for him. And so I had to say, is there any way you can actually just make your own evening meals as well and get off the carbs and the sugar and the garbage that he's putting in the meals? And she said, well, that's going to be hard. So we started with a walk and with breakfast, and cutting out the coffee. Those were the 3 things we started with. And we built the program fairly quickly over a couple of months. And it didn't take us long till she came back in. It was like maybe 3 or 4 months later. She'd had her labs redone. all of her numbers were in the normal range without medication. Her doctor was thrilled because the doctor had threatened all kinds of meds. And she was doing so well. And then there was a major family event. And about 6 months later, and it derailed her, completely derailed her again. 6 months later, she had a heart attack. She survived. And now she's on 8 or 9 different medications that the doctors have really put fear into her about that she doesn't take these, she's going to die. And she's afraid to combine supplements with it. So we're starting with foods again. And we're starting with culinary herbs. Like, how do you feel about incorporating some ginger and some cayenne pepper into your meal plans? So she's now ordering the meal kits from places like Freshie and HelloFresh and places like that. And she says that's making food preparation so much easier. Her husband will eat these meals. And, because they're already very savory, she's choosing savory, flavorful things. She says it's going to be really easy to sneak in a little bit of this herb or a little bit of that herb. And she knows that what we're doing is we're beginning to lay a foundation for a therapeutic program by using culinary herbs and by changing up her diet that way. So she's back on the track, and we're so excited that she's discovered things like Freshie and HelloFresh, where she can actually then prepare foods that her husband will eat and that are good. And she says, they come and they're great, but they never have enough vegetables. So I'm always adding vegetables. I'm going, yes, such a good answer, such a good answer. So again, this confirmed that pancreas wants to be a problem. And actually, we've known that for a lot of years with her. But we see other markings in here that give us other information about the types of B vitamins she should be on and things like that. And we're able to then create that solid program for her and build it over time. You never want to give your client everything you know all at once. So my mouse is very touchy today. So with that, we want to talk about iridology on a broader scope, about why would you want to learn iridology? Why would you want to incorporate it into your practice? Well, every student has a different reason, right? Some want to be able to assess their clients more quickly. The idea of iridology is not to look at the eyes, then take 2 or 3 hours and go and write a detailed protocol and then bring that back to your client. Don't do that. Don't do that. It takes you 2 or 3 hours to assess and write. You're going to give your client way too much information. They're going to get overwhelmed. This helps you to be more accurate. Where do you need to focus and why do you need to focus there? Helps you to ask the right kinds of questions as well. It helps you to develop better and faster rapport because you're not giving your clients a lengthy questionnaire, right? You're asking them questions about them based on what you see in their eyes and what their symptoms are. And it helps you to eliminate the need for that intake form. You still need a signed release form, absolutely, but you don't need a questionnaire. That leads us to some information about the dynamic iridology assessment system for health professionals. This is the only live, online, fully mentored course for nutritionists, herbalists, naturopaths, registered nurses, EMTs, physical therapists, anyone who's got a college level anatomy and physiology course already under their belt. And it's to help you streamline your clinical work without sacrificing client care. And actually, it will enhance your client care. It's going to help you to develop your client programs quickly on the spot. It's going to help you stop overwhelming your clients with programs that they just simply cannot manage. That is going to lead to better client compliance. It's going to let you build a program from one appointment to the next to the next. It's going to mean your clients are more successful, and that's going to lead to long-term retention. I have so many clients that have been with me for 20 or more years, and I love it. I've got many third-generation clients as well, where I took care of the grandma when she was having the mom, and now I'm taking care of the mom while she's having babies, right? And I love that. It's so nice to have that continuity, right? The next dynamic iridology course starts tomorrow. I know that's short notice, but before you shut off and go too soon, can't do it, just let me give you a little bit of why you maybe could. Number one, there's a few slots left. So there is room for you. I keep my cohorts very small. This isn't going to be like 40 people in the class where you never get to ask a question. I keep my cohort small. There is still room. But the other thing is that I've had some students enroll 2 or 3 weeks into the course, and because of the way the course is set up, they found it very easy to get caught up, right? And so that's a good thing. So, if we have a conversation in the next few days about the course and you're going, yeah, I want to do it, but you've already started, that's okay. That's perfectly okay. So this link that you see on your screen, which I'm going to put in the chat box, and I'm going to make sure I send it to everyone. There you go. That's the link to book a time to chat with me about the course, to see if it's a good fit for you. This is not a high pressure sales course, sales call. This is, do you have anatomy and physiology? Where do you want iridology to take you? Is this a good course for you? And it's not for everybody, and I know that. And if I don't feel it's for you, I'm not going to try to talk you out of it, but I'm going to suggest that there might be other things that might be a better option for you. If it sounds like it's a good fit, I'm going to invite you to enroll, right? The course, again, starts tomorrow at 1 p.m. Pacific, 2 p.m. Mountain. Barb, do I have that right? I'm just suddenly thinking I've got these times wrong. And Barb has enrolled in the course. Barb, help. Yeah, do I have that right? So Bianca, yes, you're getting a recording of this. And no, the times are wrong. The times are wrong here. It's actually, Barb, we both need to show up at the right time tomorrow. Class tomorrow starts at 12 noon Mountain, which will be 11 a.m. Pacific, 1 p.m. Mountain, 2 p.m. Central, 3 p.m. Eastern. So we actually talk about the tuition. Blanca is asking about, we talk about the tuition on the call. Right? I'm only going to talk about tuition with you if I feel like the course is a good fit. There's no sense in us even talking about tuition if it's not going to be anywhere near a good fit for you. Okay, so here's what Michelle Davies said. She has so many credentials under her belt, and she was already certified by another iridology instructor, and she'd had 3 levels with him. She said, I asked her, why did you take my course? You've got all this certification already. She said, I wanted the latest info from an experienced practitioner that has used iridology in nutritional practice for a long time. Having my classroom at home, because it's delivered via webinar, by live interactive webinar, allowed me to have all my charts and books at my side and made it easier. And having an awesome sharing and caring teacher made it the best. Judith helped me better my nutritional iridology practice. I recommend her course to everyone. Stephanie Morgan, I asked her, why did you enroll in this? She said, and she has a master's degree in education. So she knows teaching. She said, I'd seen enough of instructors online to know you were the best teacher, the way you organize info, check for understanding, and coach your students. Other instructors know their stuff, but you have the heart of the teacher. I wanted to graduate with understanding, not just knowledge. And I'm going to tell you, I've had people come into my course that are already IPA certified. And they've told me, I'm certified, but I don't know how to use this. I can pass a test, but I don't know how to use it in clinical practice. And that's something that we do in the course. We learn the nuts and bolts so you can pass the test, but we also spend a lot of time practicing. How do you integrate this into practice? The client has these symptoms. We see these markings. What questions does that mean you want to ask? What recommendations does that mean you want to make? Right? And without the knowing the questions and without the knowing what recommendations to make, without knowing how to connect the markings to each other, to the symptoms, you just know nuts and bolts and you're going to be frustrated. So I mentor you to help you learn how to use this. Like I said, touchy button here. So 22.25 hour long web-based classes, 1 per week. 2 extra 1-hour group mentoring sessions per month. These are optional, as in they're included in your tuition and you can attend them if you want. You don't have to. You can keep attending these after you finish the course, even after you've certified, should you choose to certify. The textbook is digital downloadable, so you don't even have to buy a textbook. The study notes, the cheat sheets, are also digital downloadable. The recordings of your classes are also included for you, as are recordings of the mentoring sessions. We have a small class size, no more than 10 students per class. And I include the one-on-one mentoring you need to certify with IPA. Most teachers charge extra for that. When you go to the IPA website, you're going to see it talk about level 1 and level 2. And then, but I don't teach it as level 1 and level 2. I've combined them all because I interweave the topics in a way that makes sense, right? And so that's why, exactly why I call mine dynamic iridology instead of level 1 and level 2. It's the full curriculum that IPA expects, plus a whole lot more. So again, the next class is coming up. Ignore these times because they are incorrect. The next one is coming up. It's starting tomorrow. And I don't even have, I've got one call slot left for later on today. And then no more call slots left till Friday. So even if you're thinking, I want to get in on the April 11th, book a call for Friday. Then I'm at a conference for a few days, or early next week, and we can still get you into the April 11th, 2024 start date. All righty. So, I just want to thank you very much for your questions and your comments in the chat box. I love the interaction. Are there any other questions that I can answer for you right now? I love also the way you were thinking when I got you thinking about sympathetic, parasympathetic. Why would pupils respond here? Why can we do this? Why can we do that? And you got things thinking and you got things working through. That's what I'd love to see in my students, is that they're applying what they know and integrating what they know into what they're learning. Makes it so much more valuable. With that, my friends, thank you so much for being with me today. I truly appreciate it, and I look forward to speaking with you very soon. Take care and have a great day. Bye for now.